Hello and Minglaba, welcome to MI Radio's Myanmar Today. I'm Henry Zin. Government to beef up measures and plans to prevent nationwide spread of virus through workers' return. Some updates on current education and economic sectors of China. And a story coverage on the Ministry of Health and Sports receiving medical supplies from China Foundation. All of that coming up later, but for now, let's take a look at what's happening in local news. State Councillor Aung San Suu Kyi, who's also the chairperson of the National Central Committee for COVID-19 Prevention, Control and Treatment, held a video conference on Tuesday from the Presidential Palace in Naypyidaw with chief ministers of Kayin State, Mun State and the Ninai region. The state councillor said the aim of the meeting was to discuss the return of Myanmar migrants from the border. Some expected the number of returnees would be about 150,000, while others estimated the number to be 70,000 or 80,000. At present, migrant workers have not yet returned in bulk, and that it was a relief for the country. Communications and cooperation with the Thai government seem to be good. Kayin State plays a crucial role in this program as most of the migrant workers have come back home through the Myawaddy border crossing before heading to the respective regions, while some of them returned through the Ninai region. During the discussion, the state councillor also advised assistance from Mun State to the Kayin State in case of a large number of returnees because there were many quarantine centers in Mun State. Spoke about the need for union spirit among the people, that the returnees were being sent to their respective regions and states due to insufficient quarantine centers in a single area. Staying in quarantine at the respective areas would help the returnees live closely with their relatives, would also give them moral support. If the number of migrant workers to Kayin State was significantly high, some of them would be sent to Mun State. She added that home quarantine was not practical in Myanmar, although the developed countries prefer this system to facility quarantine. Home quarantine has not been practical due to local conditions. Since the pandemic occurred in Myanmar, the cost of facility quarantine is significantly high for Myanmar. Therefore, well-wishers and civil society organizations play a crucial role in this program. Union Minister for Health and Sports Dr. Myanmar Today presided over a video conference meeting Tuesday about prevention and precautions of most monsoon common diseases amid the ministry's measures against COVID-19. The Union Minister discussed preparations for reduction of death rate from most monsoon common diseases, as there were a total of 80,000 dengue fever cases from 2017 to 2019, with a death rate of 450 in total. He added his ministry will carry out prevention and control of dengue fever with a national level action plan this year, as most of the communicable diseases could be prevented through hand washing, sanitation, and personal hygiene. The Union Minister also called for promoting the role of medical research in treatments of most common monsoon diseases, adopting future plans beyond COVID-19 outbreak, holding meetings with partner organizations, local and international NGOs and civil organizations. Senior health officers also discussed prevention of seasonal flu, transmission of COVID-19 among the evacuated persons from natural disasters in monsoon, and other common diseases in the monsoon period. The National Health Laboratory in Yangon tested 186 samples, the Department of Medical Research tested 106 samples, and the 100-bed Defense Services General Hospital in Naypyidaw tested 363 samples, totaling 655 on Tuesday, and no COVID-19 positive case was found. There are a total of 161 confirmed cases in Myanmar up to 8 p.m. on Tuesday. Out of the old confirmed cases, a total of 49 persons were tested negative for 2 times until Tuesday. 6 COVID-19 positive patients have died. There are a total of 98 new persons under investigation in the past 24 hours from Tuesday noon. India donated medical supplies to aid the containment and treatment of COVID-19 in a ceremony at Yangon International Airport on Tuesday. The donation is organized by the Embassy of India in Myanmar. Indian Ambassador Mr. Saurabh Kumar said upon request of the Myanmar government, India donated the medical supplies. Press release of Indian Embassy in Yangon stated the contribution is indicative of the traditionally warm and friendly ties between India and Myanmar and would augment Myanmar's determined efforts to fight the pandemic. The value of donation, 13 kinds of medical supplies, is at $900,000 US. There will be other donations in the future. According to Director General Dr. Ta Tun-jo, China, South Korea, Singapore, and Japan also donated medicine, medical equipment, and accessories to Myanmar to fight the COVID-19. That's all with the local news. Let's take a look at the first report now. State Councillor Aung San Suu Kyi hosted a discussion with the chief ministers of Kayin State, the Ninai region, and Mon State on COVID-19, and it was broadcast live on social media on Tuesday. The State Councillor called on regional chief ministers to prevent nationwide spread through workers' return via border gates. Agajo has more on the story.
State Councillor Aung San Suu Kyi called on the chief ministers from Kayin State, the Ninai region, and Mon State to work together in the preventative measures against the spread of the COVID-19 infection to the entire country. State Councillor hosted a discussion with the chief ministers on COVID-19. First, State Councillor discussed with the Chief Minister of the Kayin State on the return of Myanmar workers from Thailand. State Councillor Aung San Suu Kyi praised Thailand's measures in managing the Myanmar workers returning to Myanmar from Thailand at border gates.
I would
like to discuss the return of Myanmar workers from Thailand with the Chief Minister of Kenya State. We expect the return of about 150,000 workers. I understand that the inflow of the returnees is not that in a rush for the time being. It is because of the rules and regulations of the Thai government. So it's good for Myanmar since the return does not come in bulk. Thus, we have time to get ready, test, and relocate batch by batch. So I understand cooperation with Thailand is good.
Majority of the Myanmar workers to return from Thailand go through Myawaddy, which is the second biggest among Myanmar's 15 border trade posts. The Nindai region and Mon State also see travelers crossing the borders. Kayin State Chief Minister Don Nakin Twimian said the first batch of the returnees was done in a rush, but the second batch is done through enough time and proper system.
In the first batch, more than 70,000 to 80,000 workers officially returned to Myanmar via the number 2 Friendship Bridge. Of the returnees, 14,000 are from Kayin State, and the rest from Bago, Mon, and Makwe, totaling more than 50,000. Since the first batch entry coincided with Dinjan, about 3,000 returnees got stuck, and Mon State government took care of 1,000, putting them into facility quarantine, and the remaining 2,000 are taken care of by the Kayin State. On 28 and 29 April, all of them returned to their native places. Among them, those in Kayin State were tested negative, and Mon State saw one positive case, which is now tested negative. So for that first batch, we had to do it in a hurry, but it was a success. For the second batch, we have made a lot of preparations. We have got 2 weeks to prepare. So according to the list for the second batch, 25,748 workers are from Bago, Makwe, Mon, and Mandalay. So for this time, we have arranged more counters so that returnees don't need to cram.
Pa'an is prioritized for the preparation plan as Myawaddy and Pa'an are better connected now. In Myawaddy, there are a small number of rooms for the patients. However, there are equipment and facilities such as ventilators and statisticians. State Councillor urged the returnees to come back whether they went to work in Thailand officially or not, since the government prioritizes the workers' safety. The Nindai region's Chief Minister Myan Maung said.
In the first batch, there are over 6,200 returnees and more than 1,000 locals are under medical observation. So they are put into facility quarantine, and initially they were kept under home quarantine. But some people go out during home quarantine, and so we put together all of them and are put into facility quarantine. We have learned that about 1,080 people from the Ninai are coming home through Myawaddy, so we are planning to pick them up in Myawaddy.
This is Agajo reporting for Myanmar International Radio.
Stay with us, we're going to bring you more reports on Myanmar Today. With about 80% of recovery of the economics sector and the reopening of schools across China, this report covers how the current education system and the economics sectors have been impacting China. David Tanner has more.
With China's determination to combat COVID-19, its vast and dynamic school education system has been implemented into an e-learning online education system for a certain period of time. Moreover, incidentally, China also boasts of the world's largest online population with around 840 million using the internet, showcasing the innovative ways. Mazachi Newin from CRI Myanmar Department from China Media Group will also share with us update on the current situation of the reopening of schools in China and how the education system is working now.
တရုတ်နိုင်ငံမှာအခုဆိုရင်တော့ကျောင်းတွေကတော့ပြန်ပြီးတော့ဖွင့်နေပြီ3လပိုင်း4လပိုင်းလောက်ကတည်းကစပြီးတော့ပေါ့နော်တဖြည်းဖြည်းနဲ့နောက်ပညာရေးစနစ်မှာဆိုလို့ရှိရင်လည်းအခုပေါ့နော်ဆရာမတွေကနေပြီးတော့ကျောင်းသားတွေကိုဓာတ်ရိုက်သင်ကြားပို့ချတဲ့ဒီပညာရေးစနစ်တွေကိုပြန်ပြီးတော့ကျင့်သုံးနေပါပြီဒါပေမဲ့အရင်နဲ့အခုကကွာခြားသွားတာကဘာလဲဆိုတော့ COVID-19 တိုက်ဖြတ်ဆဲကာလမို့လို့ဒီကျောင်းသားတွေရဲ့ကျန်းမာရေးလုံခြုံမှုအတွက်ပေါ့နော်နေ့စဉ်ကျောင်းတက်တဲ့အခါတိုင်းမှာကျောင်းသားတွေကိုကိုယ်ပူချိန်တိုင်းတာပေးတယ်နောက်ကိုယ်ပူချိန်တိုင်းတာတယ်ကိုယ်ပူချိန်ရှိတဲ့ကျောင်းသားတွေဆိုလို့ရှိရင်လည်းကျောင်းထဲကိုပေးမဝင်ဘူးပေါ့နော်ဆေးရုံကိုပို့ပြီးတော့ဆေးကုသမှုခံယူခိုင်းတယ်ပေါ့ကျောင်းသားအားလုံးကလည်းအခုချိန်မှာ mask တက်ရတယ်ထမင်းစားခန်းတွေစာသင်ခန်းတွေမှာဆိုလို့ရှိရင်လည်း social distancing လုပ်တယ်ဒီစာသင်ခန်းဆိုလည်းလူရေကန့်တက်လိုက်တာပေါ့နော်တစ်ခန်းကိုကျောင်းသား35ယောက်ထက်မကျော်ရဘူးဒီလိုမျိုးတွေပေါ့နောက်ကျောင်းသားတစ်ယောက်နဲ့တစ်ယောက်ဆိုလည်း1 meter အကွာဝေးမှာနေရမယ်ပေါ့
China's education sector hasn't been prepared, hoping for the disruptions and repercussions of COVID-19, but one push came to shove, they immediately reworked the syllabus to adapt to e-learning for every course. But even with all those adaptations, there has been some difficulties in the rural areas for these kinds of education system to adapt. Mazachi will tell us more about how the reopening of schools has been helping the rural parts of China.
နောက်ပြီးတော့ဒီ COVID တိုက်ဖြတ်ရေးရဲ့ COVID တိုက်ဖြတ်တုန်းက online ပညာရေးစနစ်နဲ့အခုဓာတ်ရိုက်သင်ကြားတဲ့ပညာရေးစနစ်ဆိုလို့ရှိရင်အခုပညာရေးစနစ်ကပို့ပြီးတော့အဆင်ပြေတယ်လို့သူတို့ပြောဆိုကြတယ်။ဘာဖြစ်လို့လဲဆိုတော့ဒီ COVID တိုက်ဖြတ်နေတဲ့ကာလက online ပညာရေးစနစ်တွေသင်ကြားတဲ့အခါမှာဒီမြို့ကြီးတွေမဟုတ်တဲ့ပေါ့နော်။ပြီးကင်းတို့ရှာဟာမြို့ကြီးတွေမဟုတ်တဲ့တချို့ဝေးလံတဲ့ဒေသတွေကကျောင်းသားကျောင်းသူတွေကဒီ online ကစတင်ရတာတိတ်ပြီးတော့အဆင်မပြေဘူးအခက်အခဲရှိတယ်လို့သိရတယ်။အခုဆိုရင်တော့ဒီတရုတ်တစ်နိုင်ငံလုံးပေါ့နော်ရာခိုင်နှုန်း90ကျော်လောက်ကျောင်းတွေပြန်ဖွင့်နေပြီလို့သိရပါတယ်ရှင်
Tourism, which is among the worst hit sectors amid the COVID-19 crisis, is expected to witness a radical shift with a new wave of slow and smart tourism taking center stage and an increased momentum for health and wellness in China. With that said, Mazachi will tell us more about how the hotel and tourism sector working in these current situations.
တရုတ်နိုင်ငံမှာဒီ hotel တွေနဲ့ခီးသွွားလုပ်ငန်းတွေနောက် night market တွေစားတောက်ဆိုင်တွေတခြားစီးပွားရေးလုပ်ငန်းတွေပေါ့နော်ပြန်ဖွင့်နေပြီတရုတ်လူမျိုးတွေကလည်းအရင်လိုပဲသွာလာလှုပ်ရှားနေကြပြီနောက်ပြီးတော့ဒီနောက်ပိုင်းပေါ့နော်ခီးသွွားရှုခင်းသားနေရာတွေလည်းပြန်ဖွင့်နေပါပြီဒီတစ်ဖက်ကလည်းဒီ COVID-19 ရောဂါကာကွယ်ထိန်းချုပ်ရင်းနေပေါ့နော်ဒါပေမဲ့ဒီခီးသွွားနေရာတွေမှာကြတော့ခီးသည်တွေစုပြုံပြီးတော့မနေစေဖို့ပေါ့နော်အချိန်စရာတွေအတိုင်းဖွင့်လိုက်တယ်ဝင်လာတဲ့ဒီခီးသည်တွေကိုလည်းခီးတဲ့ဥယျာဉ်တွေကိုလည်းကန့်တက်လိုက်တယ်နောက်ပြီးတော့လက်မှတ်တွေကြိုးမှာတဲ့နီးလန်းနေနဲ့သူတို့တင်းတင်းကြပ်ကြပ်ဆောင်ရွက်နေတယ်အခုပီကင်းရှင်းဟောင်းနှံတော်ဆိုလို့ရှိရင်ဒီမေလ1ရက်နေ့ကစဖွင့်နေပေါ့နော်ဒီလက်ပတ်တဲ့သူတွေဝင်လာတဲ့အခါမှာmask တွေတက်ရတယ်တယောက်နဲ့တယောက်ဆိုလဲ1.5 မီတာအကွာဝေးမှာတန်းစီရတယ်ဒါပေမဲ့ခရီးသည်တွေကတော့အရင်လိုတော့အရန်အများကြီးမသွားလာကြသေးဘူးစိုးရိမ်စဲအခြေအနေမှာပဲရှိကြသေးတယ်
Mazachi also added on and updated us with the local visitors across the whole country of China and the income from it
မေလ1ရက်နေ့ကနေပြီးတော့3ရက်နေ့အထိဆိုလို့ရှိရင်ထုတ်ပြန်ချက်တွေရပါတော့ဒီတရုတ်တပြည်လုံးပြည်တွင်းခရီးသည်ဥယျာဉ်ဆိုလို့ရှိရင်84.99သန်းကျော်လောက်ရှိပြီးတော့ဒီပြည်တွင်းခရီးသွားဝင်ငွေပမာဏကတရုတ်ယွမ်ငွေ35.36ဘီလီယံရှိတယ်လို့သိရတယ်ခီးသွွားလုပ်ငန်းတွေမကဘူးဒီတပြည်လုံးပေါ့နော်နေထိုင်ရင်ဝန်ဆောင်မှုလုပ်ငန်းတွေရဲ့ပြန်လည်လက်ပတ်မှုနှုန်းက80%ကျော်ရှိရလို့သိရပါတယ်စိန်ခေါ်မှုအနေနဲ့ကတော့ဒီလက်ရှိအချိန်မှာပေါ့နော်ဒီလုပ်ငန်းကုမ္ပဏီတွေက ရောင်းဝယ်မှုတွေလုပ်တဲ့အခါမှာစားသုံးသူတွေကမဝယ်ယူရဲတာတွေနောက်ဝယ်ယူဖို့စိတ်မချတာတွေဒီတွာလာရေးနဲ့ပတ်သက်ပြီးတော့ခီးသွွားလုပ်ငန်းနဲ့ပတ်သက်ပြီးတော့ခီးတဲ့ပမာဏတွေနည်းတာတွေပေါ့နော်ဒီလိုတွေကြောင့်ဝင်ငွေရော့နည်းလာတာတွေဒီလိုအခက်အခဲတွေကတော့ရင်ဆိုင်နေရဆဲဖြစ်ပါတယ်
Reporter David Tanner reporting from Myanmar International Radio.
Well, let's move on to the last report before we go to international news. The Ministry of Health and Sports received donations of masks, PPEs, and other equipment by China Foundation for Peace and Development, where the equipment worth more than 5 million renminbi was handed over. According to the statement from the Ministry of Health and Sports, these donated equipment are very much essential for the healthcare workers who are working in the front line in the fight against COVID-19. Wilson has more on the story.
With the aim of helping the government in fighting against COVID-19 in Myanmar, China Foundation for Peace and Development donated several medical supplies to the Ministry of Health and Sports, and the ceremony of handing over donation was held on 5th of May at Department of Medical Research in Yangon. Those present on the occasion were Mr. Cheng Hai, the Chinese ambassador to Myanmar, Mr. Wang Desheng, Director of the Office of China Foundation for Peace and Development in Myanmar, and Dr. Zhou Tun, Director General of the Ministry of Health and Sports. According to the statement released by donors, the donation included more than 1.5 million masks, PPEs, and several other related items, which are very much necessary for the respective departments in the fight against COVID-19. All the equipment donated to the Ministry of Health and Sports is estimated to be worth around 5.5 million RMB, according to the donors. The donation carries the slogan of Joint Action for Defeating COVID-19 through Silk Road Community Building Initiative, and it is also aiming to cooperate civil society organizations to carry out anti-pandemic cooperation, which will be implemented by China Foundation for Peace and Development. Speaking to the media at the donation ceremony, Mr. Cheng Hai, the Chinese ambassador to Myanmar, said,
包括民间组织在内的社会界别的捐助当中，是金额。
Today, the donation brought to us by China Foundation for Peace and Development has done one of the biggest donations ever carried out by any Chinese non-governmental organization. It shows China is willing to help the government of Myanmar and the people in this crisis. This China Foundation for Peace and Development has been donating in different parts of the world in the fight against COVID-19. But what the foundation has donated in Myanmar now is their biggest donation ever. On the other hand, it also means that this foundation is willing to help Myanmar in defeating COVID-19 in Myanmar. All this collaboration is also a part of Belt and Road initiatives, goals between the member countries where the social organizations come together as one in this kind of crisis. Giving priority to the health of the common people is also one of the top priorities in Belt and Road initiatives.
According to Mr. Wang Desheng, Director of Office in Myanmar of China Foundation for Peace and Development, as Myanmar and China share a long border, it also shares the common cause in this crisis of COVID-19. Therefore, China is very much willing to help Myanmar in defeating COVID-19 as it gives negative impacts on economy. Speaking to the media, he also said,
所以呢，这次我们呢响应这个中国民间组织国际交流促进会。
When the crisis of COVID-19 was height in China, Myanmar was helping China. The helping hand offered to us by Myanmar will not be forgotten so easily by the people of China. Now that we have seen many countries are reporting COVID-19 cases, China is ready to help those countries affected by COVID-19 as a return of their gratitude. The main aim of donating all these supplies is helping Myanmar in defeating COVID-19 soon. In the last 10 years, we have already donated the items worth around $10 million in Myanmar.
Speaking to the media, Dr. Zhou Tun, Director General of Ministry of Health and Sports, also said,
ဒီကိုဗစ်တိုက်ဖျက်ရေးမှာရှေ့တန်းကနေတိုက်ပွဲဝင်နေကြတဲ့ဆရာတော်ကျန်းမာရေးဝန်ထမ်းတွေဒါအားလုံးကမရှိမဖြစ်လိုအပ်တာပေါ့နော်ဒီဝတ်စားတွေဒီ
All the equipment which we received today includes masks, PPEs, and other production tools, which are very much essential for all the health workers who are working in the front line of containing COVID-19. As we all know, COVID-19 is a contagious disease Therefore, in protecting from this virus, PPE is one of the most crucial tools. For example, if there are 10 healthcare workers who are treating one COVID-19 infected patients, we will have to put all those 10 workers into quarantine unless they wear PPE. We cannot afford to lose that much of human resources and find replacement. Therefore, the donation which we received will be helpful for us a lot.
This is Williamson for MI Radio.
And that's all we have for today's reports. Let's check on some international news now. A leading epidemiologist who advised the UK government on its coronavirus response resigned from his government post on Tuesday after the Telegraph reported he broke the lockdown rules he helped shape. Professor Neil Ferguson, based at the Imperial College in London, is one of the architects of the UK government's stay-at-home strategy and a prominent member of Britain's Scientific Advisory Group for Emergencies, which has been spearheading the coronavirus response. In a statement on Tuesday, he said he was resigning his post on the government's Scientific Advisory Group for Emergencies over an error of judgment. The Telegraph revealed that Ferguson's friend had crossed London from her family home to visit him on at least 2 occasions on 30th of March and 8th of April since the lockdown measures were imposed. The World Health Organization on Tuesday urged countries to investigate any suspicious early cases of COVID-19 after French scientists said a man may have been infected with the disease as early as December 27th. The case points to the presence of COVID-19 in France nearly a month before the French government confirmed its first cases. The latest remarks by WHO spokesman Christian Lindmeier come as the number of COVID-19 infections worldwide exceeded 3.6 million, with the death toll going beyond 253,000. As the war against the disease continues, world leaders on Monday pledged some 7.4 billion euros towards research into a possible vaccine and treatment. A recent study by a Stanford University professor found that COVID-19 cases in Santa Clara County, California, are actually higher than the confirmed count officials give. CGTN correspondent Wu Guoxiu spoke with the professor behind this study to learn what's driving the change in numbers.
You claim that the population prevalence of COVID-19 in Santa Clara County, where you are now, is 50 to 85 times higher than the confirmed cases now. So why is there such a huge difference?
Up to date, there have been about 1,000 people that have been identified with the virus active. So that's a 50-fold difference between, roughly 50 to 60-fold difference between the number of cases that are identified with the virus, with the PCR, the clinical test, versus the antibody evidence. So what that means is that a very large number of people were previously infected. Basically, most people with mild symptoms, they don't go get tested because they have a mild cold. There's no reason for them to go get tested.
Do you know if there are similar situations in other areas of the United States?
Yes, so actually it's in Los Angeles County, in Telluride, in Miami-Dade, in upstate New York. A whole bunch of other places find very, very similar results to Santa Clara County, about 3 to 4% prevalence with about 30 to 50 times more cases in the antibody evidence than in the number of identified cases. But that's not just true in the United States. That's true in Kobe, Japan. That's true in Sweden. That's true in Denmark. That's true in Germany. A whole series of antibody studies have found basically the same result.
In other news, with social distancing measures brought in across Europe during the COVID-19 lockdown, it can be tough to find something to do outside your house. Some countries across the continent have come up with an innovative way for people to enjoy a movie night out while obeying restrictions with the introduction of drive-in cinemas. One of these cinemas has been set up at the currently deserted Vilnius International Airport in Lithuania. Visitors get to watch a best-selling movie while enjoying the view across the airport. Hundreds have flocked to the event, organized by the Vilnius Film Festival, as cars maintain a 2-meter distance, with a maximum of 2 people per vehicle allowed.
Last year we are screening the films in a freshly closed jail in Vilnius, and now we are in airport, and this is the way where people can watch safely, watch the films, but at the same time to feel a little bit of sense of this excitement when when you're going to travel, when you go to the airport and you can see all the planes. But to travel nowadays in a safe way, to travel watching through the films.
Šiaip smagu karantino metu, taip ilgai sėdint namie, išlysti iš tų namų, bent su automobiliu ir kažkokių pramogų patirti.
Britain begins post-Brexit trade talks with the United States on Tuesday, with 100 negotiators on each side joining via video conference. Many in Prime Minister Boris Johnson's Conservative government hope for a free trade agreement with Washington as one of the biggest benefits of leaving the European Union. Officials said the first round of talks would last 2 weeks and cover issues such as goods and services trade, digital trade, investment, and how to support small businesses. The US ambassador to Britain, Woody Johnson, said the deal could jumpstart the economy after we conquer coronavirus, a message repeated by British officials. Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. Wherever you are, please stay home, stay safe, help yourselves to help the world. I'll see you again. Goodbye.